Namaskar. Lower back pain is one of the major causes of visiting a healthcare professional in the world. In fact, demographic data says it may be the second most common reason why patients seek healthcare advice or professional advice. Lower back pain is because of multiple reasons. It's very difficult for a patient to himself or herself find out what is the exact cause of pain in his or her lower back. Lower back pain is mostly harmless, temporary situation where the right balance between activity and rest may be very helpful. But somehow, due to availability of a lot of examination, a lot of procedures, sometimes we may make minor lower back pain into a major issue. Having said that, the fact is there are certain cases, there are certain kinds of back pain which may need immediate attention, which may need a visit to the emergency department, which may need surgical interventions. What largely stays as a truth is that most of the lower back pains, not all, but most of the lower back pains are harmless, can be treated by just balancing the activity or activity and rest variations. In this kind of approach, physios can be very helpful. How a physio approaches your lower back pain also may depend on the individualized protocols or school of thought that your particular physical therapist believes in or follows. But at last, the basics, the understanding of the subjects in the very basic manner remain more or less same. Over medication, over treatment, over diagnosis sometimes creates a panic situation for the patient, and that is why a patient should approach the right people at the right time, and mutual referrals should be taken up as per the requirements of the case between the healthcare professionals. Uh, there are patients which we have seen which get worried immediately as soon as they develop some sciatic nerve pain or the neural pain aspect of lower back pain. No doubt, sciatica is a difficult problem to handle. Sometimes it may last for days, weeks, and even months. But not all such cases need much treatment. Some of them may be very temporary situations, may be situations where other factors may be playing its own role. So, a patient has to understand that as the pain comes, there is a constant requirement of monitoring of the symptoms. If there is any kind of worsening over a quick time, over just few days, if there is a problem with strength of the particular leg or particular side of the body, or if the lower back pain itself is not letting you get up from the bed, if it's really that bad, then definitely you need healthcare advice from the person or people or the kind of practice that you believe in. But just for every minor back pain, we need not rush. We can take some time, we can take an understanding, we can follow a few basic advices from online consultations, or even your general physician can help you sometimes in just guiding you with the kind of rest, kind of amount of uh, time that it may take to recover, or the complexity of the problem. He may be able to guide you in the right situation to the right professionals if at all required. The idea should be very simple, that lower back pain is not happening only to you. Lower back pain is very, very, very common. So common that almost most of us, almost every second individual, or if you go by demographic data, then uh, out of 10, many people get it. And not everyone ends up on the surgical table. Please take care of your lower back pain with basic protocols. Do not complicate it by asking your professionals to go for unnecessary tests. We have seen situations where uh, the professional may not want to send you for certain referrals, but you may insist, a patient may insist, just because he knows the name of certain tests or protocols. Just make it easier, not complicated. But at the same time, make sure when it is showing symptoms which need to be attended to immediately, rush to the nearby hospital, rush to the nearby clinics, seek right advice. Thank you.